Have behavior and learning problems in school. Nobody knows why. They think the kid is bad, dumb, and lazy, and they think the parents are probably bad, dumb, and lazy. I can assure you that if a child has allergies, if their brain is being affected, they can't read some of them. They can't write some of them. They can't express themselves sensibly. They will explode and suddenly become violent for no reason at all. Most people think of allergies as just hay fever, asthma, and itchy skin, often in the arm creases or leg creases. But when it affects any area of your brain, it crawls behind the furniture, under the furniture. You go to touch it and they pull away like that and scream. They say they want to die. They say they want to kill you. Some of these children do commit suicide. Some of them do try to kill their parents. They really lose all contact with reality. Purifiers you can try for 1 month for $25. You send it back, you get the rest of your money back. So it doesn't cost you much to try the air purifier if dust, mold, pollen, and chemicals are your problem. If it's a food that's your problem, it doesn't cost you a dime to do it. You can do it all on your own. Just take away those major foods that cause trouble. You will live fine on fruits and vegetables. Got tapes here that show examples of children and adults reacting to dust, mold, pollen, foods, and chemicals. You don't have a lot of money, go to my website. There's about 40 small DVDs that you can look at. You'll see one DVD, I believe, of Mary Ann, and when she came into the office, she walked like this. Her favorite food was bread. She ate 8 slices a day. That told me immediately she's allergic either to wheat or yeast. I put a drop of, I'm an allergist, I put a drop of wheat in her arm and nothing happened. It wasn't the wheat, I put the drop of yeast in her arm and she could barely walk, and you'll see the video. I gave her a dilution of yeast. Get the right dose, you give 1 to 5 dilutions, 1 drop every 8 minutes. When you hit the right dilution, she walks like this. No trouble at all. The point is that our bodies are so much smarter than we are. If you put a drop of the wrong thing in the body falls apart. You put a drop of the right thing in the right dilution, the same thing, and all of a sudden the body is fine. Isn't that just, it's amazing to me. I put a syringe and I barely touch the skin, start to put in the right dilution, and they'd be fine. And so it was so spectacular in my office that I videotaped everyone for over 20 years. So I have lots of pictures that document what I've just said. The pity is that the vast majority of doctors, those in the medical profession, parents have no idea that all these ordinary substances can affect any area of the brain. And I've had children that were told they'd be in psychiatric institutes for the next 20 or 30 years, and we found out it was a fluoride in the drinking water causing problems. You get them on pure water, and they aren't depressed and suicidal all the time. In medicine, the answer isn't a bigger, better, more insurance-covered pill. The answer is to find the cause. If you've got a nail in your shoe causing a sore in your foot, the answer is to pull out the damn nail. And somebody has to teach you how to find the nails, and you'll find in my book. I'll tell you, is it a food? Is it a chemical? Is it inside your house? Is it outside the house? Is it only in the bedroom? Is it only in the bathroom? Is it only in the kitchen, the basement? Where do you tend to get sick? You're sick at school, but you're not sick at home? There's a reason. If you just get everybody to say, what did I eat, touch, or smell? You will come up with answers that everybody else has missed, because nobody knows your body like you do, and nobody is going to spend the time that you're going to spend to figure out the answers. But remember, if it's a food, it's often your favorite food, and it's not how much of that food you have to eat. Some people get sick from a speck. A bay leaf in the soup will do it. It doesn't take much. Other people need 3 teaspoons, other people need 4 glasses of milk before they have symptoms. But you can figure out the answers if you try, and you can actually even treat yourself for a food allergy, providing you don't have an anaphylactic reaction to it. Say you get a bellyache or a headache from eating eggs, Well, you would try by taking a hard-boiled egg, which is less allergenic than a soft-boiled, and you take just a little speck. 4 days later, you double it, and keep doubling it every 4 days until you're eating as many eggs as you want, or until you have a reaction. If you get this much egg and you start to react, cut down to this much and very more slowly. Every 4 days, raise it just a little bit at a time. You'll eventually desensitize you for eggs, and you'll save yourself a fortune because food allergy treatment costs money. The one doctor in this city that knows how to do it very well, incidentally, is Martha Grout. Very smart lady, grout like the tile grout, and she knows homeopathy, she knows acupuncture, and she knows the kind of allergy that I'm talking about, which is provocation neutralization. You take a history, you find out they eat bread all the time, and you test them for wheat, and then you test them for yeast. One of those two will react, and then you just give them a dilution, and you make them sick with the first one, and then every 8 minutes you give them a 1 to 5 weaker dilution. When you get to the right dilution, the body says, oh, that's what I need. And then they can go home and they can put drops of that dilution under their tongue, or they can give themselves an injection of that dilution, and lo and behold, they can eat the food to which they're allergic and not have symptoms. Doesn't that sound great? Yeah. Really nice. No pills, but I do think that you need to build up your immunity and get on nutrients and eat non-pesticided, non-GMO, non-irradiated foods. We got to start to use our head.
Any other questions?
Thank you, Dr. Rapp, for your wisdom. The dilution, 1 to 5, you said every 8 minutes?
Yes.
Like at the 16th minute, is it 125 dilution rate, or how is it? Because I'm not...
A teaspoon of milk, and you put it in a glass. That's your concentrate. Then you take a teaspoon of milk and put it 4 teaspoons of water. That's your 1 to 5. 1 teaspoon of the 1 to 5 and 4 teaspoons of water is a 1 to 25. Okay. 1 teaspoon of that plus 4 teaspoons of water is a 1 to 625. And most foods, incidentally, for infants, infant allergies are so easy to treat. It is almost always a 1 to 5 dilution of milk, a couple of drops under the tongue, and the colic will be gone. The baby pulls their legs on their belly and they scream when they're fed. You just take the milk and dilute it with 4 parts of water and put 2 or 3 drops under the tongue, and it's amazing. The belly goes down, the baby's quiet. It's just wonderful. My big regret is that the doctor that was promoting this, that taught provocation neutralization to me, which means you provoke or get them sick with 1 drop, and you neutralize with a weaker dilution. He just died. And I'm very upset because I think there's only 600 doctors in the country that know that technique, and because the insurance company determines what your medicine is like, my guess is, and insurance won't cover provocation neutralization testing, that it'll die out, and it is really a shame. Look, if you look at my DVDs, you can't help but be absolutely astounded at the people that are depressed and suicidal, and you give them the right dilution and they're smiling. The people that you can't touch, who have muscle pain, they can't walk in a minute. And if you look at the handwriting changes very dramatically. Many people, if they eat the wrong thing, their handwriting deteriorates. I'm going to be publishing a book on the handwriting changes from allergies in the next couple of weeks because it's so dramatic, and teachers, I'm sure, see dramatic changes after lunch, for example. It means a kid ate something that bothers him, and maybe it's not only affecting the handwriting, but the child's ability to learn, the academic performance. Children draw differently when they're having a reaction. They draw, they tend to be violent when they have a reaction to anything, dust, mold, pollen, foods, and chemicals. They draw blood, knives, hanging their mother, putting them in a cemetery, putting the tombstone. Their pictures are red and black. Treat them, and they're pink and yellow and pretty with nice sunlight, and there's a total difference. And in my books, I have illustrations of the pictures. Artwork is definitely affected along with handwriting. Any other questions? We are having a chance here, free advice. Well, I thank all of you for coming, and I hope I helped every one of you.
Thank you, Dr. Rapp.